It's no secret that Alberta doctors haven't quite seen eye to eye with the provincial government since Jason Kenney became premier in the spring of 2019. But like everywhere else in the world, Alberta is relying on doctors to navigate the COVID-19 pandemic. At the same time, another battle has loomed in the background for doctors, not with a virus or other illnesses, but with changes to doctors' pay that many physicians resent. Some have even left the province or threatened to. The fight has simmered, at points boiling over, for months. So how did we get here? In the lead up to last year's election, Kenney signed a giant Bristol board in February labeled the Public Health Guarantee. He vowed the UCP would maintain or increase health spending. He would commit to a universally accessible, publicly funded healthcare system if his party took office. Kenney also said a united Conservative government would review Alberta Health Services to find ways of getting, quote, more bang for the taxpayer's buck. Fast forward to September 3rd, 2019, when a key document known as the MacKinnon Report made sweeping recommendations on how the UCP government, elected just months earlier, should govern. From physicians' pay to nurses' duties and the role of hospitals, it said Alberta's entire health system needed a complete overhaul. Restrain healthcare spending and find other ways to deliver services, the panel behind the report urged. A separate report by Ernst & Young, released on February 3, 2020, outlined more than 70 ways to save nearly $2 billion per year in the healthcare system. The report said the government should expand use of non-hospital surgical facilities and emergency departments, and they should outsource laboratory services. Finally, Alberta's 2020 fiscal plan budgeted $20.6 billion for healthcare, about 43% of the government's total operating costs. The largest portion of the health budget was physician pay and compensation at about $5.2 billion. Tensions came to a head in February. Health Minister Tyler Shandro announced on February 20th the government had ripped up its funding contract with doctors. It would impose changes to physician rules and fees to control ballooning healthcare costs. Some of the changes meant doctors would bill $9 for visits over 15 minutes, down from $18. Physicians could no longer bill for overhead costs outside their clinics, and the number of patients a physician could see and bill for in a day was capped at 65. The announcement came after negotiations with the Alberta Medical Association fell apart. Shandro said the AMA had no meaningful proposals. He said Alberta doctors were the highest paid in the country. The head of the AMA, Dr. Christine Molnar, said her side proposed a 5% cut to doctors' fees. Some rural and family doctors, meanwhile, warned the change would force them to close their practices or cut service. Then, the pandemic hit Alberta. Shandro said the government would halt some of the changes, like fee changes for extra long patient visits, so doctors could concentrate on the task at hand. But the conflict didn't go away. A letter signed by 800 doctors was released on March 30th, urging the Alberta government to postpone the revamp, calling it detrimental to patients. All the while, the scandal began to plague Alberta's health minister. Just days earlier, on March 27th, Shandro was accused of berating a Calgary doctor on his driveway over a Facebook post. Critics said the incident showed Shandro was getting sidetracked when his focus should be on the pandemic. But Kenney refused to fire him. On April 9th, the AMA sued the province over changes to the way doctors could bill for their services. Dr. Christine Molnar, head of the association, said she had no other choice. The government violated the charter rights of all Alberta physicians by removing their access to third-party arbitration, she argued. Then, on April 24th, Shandro announced rural doctors would be permanently exempt from overhead billing changes when seeing patients outside their clinics. In mid-May, Kenney told the Alberta legislature that with costs rising as the pandemic continues, physician pay would have to be managed sometime down the road. On July 10th, the AMA released a survey that found over 40% of all physicians in the province were eyeing a move away from Alberta. 4 days later, they put ads in newspapers that included an offer to hold physician pay at its current levels. Then, on July 29th, they released the results of a referendum that found 98% of physicians, residents, and medical students no longer had faith in Shandro. They called for Premier Kenney to get involved in order to settle the dispute. He said he would be open to a meeting, but insisted the dispute was still about money and not about principles. The AMA and the government resumed talks in mid-August.